The Brains Hospital, which is first of its kind center for the brain as well as spine disorders, is conducting a month-long awareness program to prevent head injury in the month of March. The March month is considered as the Head Injury Awareness Month, and March 20th is the Head Injury Awareness Day. The very purpose of this is to prevent a preventable injury to the head, that is the head injury. When a head injury takes place, whatever may be the reason for it, the action should be immediate and the treatment should begin right from the scene of the accident. Normally when there is an accident, people don't bother about the injured, how he is lying down, what are the type of injuries, whether he is breathing or not, is he bleeding. No one will take account of all these things. Rather, they'll keep videoing, picturing, crowding and creating hangama on the road, hampering the rescue operations as well. It is very important. The first hour after the accident is called golden hour, and during this period a series of changes can happen in the person who is injured. Depending upon the severity of the injury, there can be bleeding, there can be disturbance of breathing, maybe unconsciousness, and once the person is unconscious, he can't take care of himself, someone need to assist. There can be multiple injuries, there can be a spinal injury, and if these things are not attended immediately, the consequences can be very grave. Now, whenever there is a head injury, there is an instant injury, what is called as a primary injury to the brain, that happens at the time of the impact. Subsequently, a series of events will take place. Person may not breathe well, he may vomit and aspirate the contents into the lung, and that can affect the breathing, and there can be bleeding, one may go into shock, there can be convulsions, and a variety of changes can happen which can complicate the primary injury, and this is what is called a secondary brain injury. And these secondary brain injuries are quite serious, and a significant number of people suffer unaccountable disability as well as death due to secondary injury. And both, we must put effort that the primary injury has to be prevented, and by all means secondary injuries have to be prevented. The only way you can prevent secondary damage to the brain is by acting in the golden hour, in the right way, by the right people, using the right method, and bringing them to the right place for the further treatment.